Lewisham Hospital Trust in South London and its busy emergency department. It was here 2 days ago Channel 4 News has learned that a healthcare assistant was stabbed by a patient who had smuggled in a sharp weapon.
A member of staff was attacked by a violent patient who had secreted a weapon into the department and stabbed them in the arm, sustaining a wound severe enough to require an operation under general anaesthetic the following day.
Speaking to us is a colleague of the person stabbed. He doesn't want to be identified, but Channel 4 News has confirmed his story. He told us about the pressures and the staff shortages in the emergency department, which he said is leading to increasing anger from patients.
We have for a long time been warning that it is really insecure with A&E, and it sounds as if these things have been falling on deaf ears. We don't have enough security staff, we don't have enough doctors, nurses, staff in general. It has been really hard over the pandemic, and that has taken its toll. And that means we're even more stretched during shifts, and that makes it more unsafe to take care of the patients, and it is a lot more stressful for everyone. You have a pressure cooker effect. So we knew we have had more than enough incidents of verbal aggression, physical aggression.
Well, what happened to that patient?
We were very lucky. What has become pretty much a daily occurrence is we have police officers in the department all the time. And because they were there with another patient, they were able to intervene and subdue the patient. And he was subsequently taken into custody.
I'm struck by how upset you are about this.
This increased indifference, violence, aggression by patients, it just wears you down. And when you know that you could see this coming and you've spoken to those who really should have their staff's best interests at heart, and that has been ignored, that is more than enough to make you really upset.
We did ask the Trust for an interview, but no one was available. In a statement, they said they were supporting colleagues in the emergency department and the member of staff who was attacked. They added, like other NHS trusts, we have been facing significant demand for our services and, sadly, rising levels of violence and aggression towards our staff, with some anger over the steps we need to take to keep people safe, such as asking visitors to wear face coverings. We held staff focus groups over the summer and subsequently invited all staff to join a task force to deal with this issue. Steps taken in response include introducing additional 24/7 security support at our hospitals. What happened in this emergency department 2 days ago has left staff shocked and frightened, but what it has not done is left them surprised. They had been warning for some time, according to our source, that something like this might happen. And it's going on across the health service, with increasing numbers of cases of verbal and physical abuse against staff. The London Ambulance Service has now appointed 2 violence reduction officers. And only last month, this matron at Northumbria Emergency Care Hospital told us about the abuse that happens regularly in her department.
Some staff have been spat at, physically hurt, required medical treatment themselves.
A government spokesperson said they have zero tolerance for violence or abuse directed at NHS staff. We are taking action through the NHS Violence Reduction Programme, they said, to protect staff, and the NHS continues to work closely with the police and the Crown Prosecution Service to bring offenders to justice.
There's a clear requirement for there to be security staff on duty in emergency departments at all times. What we do find is that many organisations have very few security guards to cover the whole organisation. So they're trying to cover really quite large hospitals with 2 small teams. So if they're called away to one part of the hospital, they can't be in another. And of course, when things happen, you need a very rapid response. And the poor security guards can't be in 2 places at once. So that's a matter of numbers.
The injured healthcare assistant from Lewisham is now recovering at home after surgery. We have been shown a picture of the type of weapon used to stab him, but have chosen not to broadcast it. But I asked his colleague, what needs to happen now?
It needs to be taken seriously. NHS staff are, I would say, they are a precious resource, but they are also not an infinite resource and not one to be taken for granted. We have staff leaving because they have had enough.